Hello, my name is Dr. Neil Baum. I'm a urologist in New Orleans, Louisiana, and I would like to talk with you about the condition called acute urinary retention, or the inability to urinate, which is a surgical emergency. I'm going to discuss the causes of acute urinary retention and what are some of the treatment options for acute urinary retention. Acute urinary retention is defined as the inability to urinate. This is a medical emergency and requires a prompt visit to the doctor's office or the emergency room. The causes of acute urinary retention are, in men, enlargement of the prostate gland. In women and men, it can be a urinary tract infection. It can be a narrowing of the tube to the outside of the body called the urethra that develops a stricture or scar, making it difficult or impossible to urinate. Urinary retention can occur after surgery, where the patient has an anesthetic that makes the bladder weakened and difficult to empty immediately after surgery. It can also be due to constipation, and also there are a number of medications that can affect the lower urinary tract, such as antidepressants, medicine used to treat the overactive bladder, amphetamines, and even opiates or pain medicine can weaken the bladder and cause acute urinary retention. So what are the symptoms that occur before the retention happens? One is that the patient usually will tell you that they have a poor stream, they have a straining to urinate, they have to push down in order to urinate, they have hesitancy of urination, they have to wait to get their urine stream started, and they have a feeling that they are not completely emptying their bladder. Just before urinary retention completely occurs, they will have lower abdominal pain, they can even have sweating, their blood pressure can go up, and it is for this reason that it is imperative that someone who is unable to urinate go immediately to their healthcare provider or the emergency room. There are complications that can occur from acute urinary retention, including permanent damage to the bladder, chronic kidney failure, and the quicker one seeks treatment, the fewer complications that will occur. Long-term urinary retention can result in bladder stones, and even the muscle of the bladder can become so thin that in its extreme situation will not be able to regain its tone and be able to have normal urination in the future. The treatment of acute urinary retention is usually the insertion of a catheter that temporarily drains the bladder. Also, if the catheter can't be inserted, a tube can be inserted in the lower abdomen that will drain the bladder, and again, it depends on the cause. For those men who have enlargement of the prostate gland, there are medications, minimally invasive surgical procedures that can relieve the problem of acute urinary retention. In summary, acute urinary retention affects both men and women. The causes are diseases of the prostate gland, infection, nerve damage, after surgery, or any blockage of the lower urinary tract. The good news is that treatment is available to relieve the obstruction, so if you are experiencing any of these symptoms, be sure to see your physician or go to the emergency room. I hope you have found this information helpful and useful. If you would like additional information, please go to my website at www.neilbaum.com, or you're welcome to contact me at my office at 504-891-8454. Thank you.